Well, in our last video, we spent a lot of time talking about the facial bones in the skull, and got a little bit on the temporal area, temporal bone and stuff like that, and the parietal bone we mentioned. But what I want to do here in this particular video is work our way around the skull a little bit more, so you can see a little bit more on what's the outside, and so now we'll know it in 3 dimensions compared to just the front. Okay, so let's go ahead and get started here and talk about the rest of the cranium. Okay, the lateral cranium, we talked a little about this before, okay, but some of the points that we didn't bring in, but I think are really important for to talk about it. First of all, what's called the external acoustic opening, and that's this area right there, okay, and you can see the same thing right down here, and that's the entrance to the ear canal, okay. If you take your finger and stick it in your ear, you can stick it in a little bit. I mean, never stick a Q-tip in there. Don't stick a Q-tip in. People always say don't put anything in your ear that's smaller than your elbow, but what happens is, sometimes when people are trying to get wax out, what happens if they take the Q-tip, they push it deeper in, it's not they're really going to jam it through their eardrum, but they take all the cerumen, which is another name for the medical name for earwax, it jams it deeper against the eardrum, so then all of a sudden that causes more of a problem. But what happens to be able to get to the tympanic membrane, we have to go through this canal, which is basically the external acoustic meatus, or external acoustic canal, okay? And basically it's leading down to what's called the tympanic membrane. So there'll be a canal that'll come down like, well, that's too close. I'm using the big thing here. Let me use the smaller. Okay, the ear canal is going to come this way, and then down a little bit into there. You can see the tympanic membrane is going to be angled like this a little bit. So this is superior here. This is inferior. Ears out here. Okay, so we see the tympanic membrane or the eardrum sitting right in there. Then behind there we have the middle ear cavity of a eustachian tube that goes down to the back of the nose, and that middle ear cavity then leads to the inner ear. Okay, so that's that. But what happens is at the opening of this meatus or canal, that's this area right there. Okay, so that's the external acoustic opening, external acoustic meatus. Okay, next thing I want to talk about is the mastoid process. Okay, shouldn't have done that in red, should I? That's pretty bad. Let's do that. Let's change that. Let's go to yellow again. The mastoid process. In the mastoid process, and let me get rid of this red here. The mastoid process is this area right here. This area is the mastoid process. That's the mastoid process right there. You could feel it, if you feel behind your ear, we mentioned this in our last video. If you feel back there, you could feel a little bump, okay? Now, actually what happens is right back in here behind, when we get to the area of the inner ear that would be back in behind here, it's like a cochlea. It looks like a conch shell back there with canals on there, which are called semicircular canals. That's a horrible picture, excuse me, okay? I'm not an artist. But what happens is that this middle ear actually sort of like to equalize pressure, to keep the air pressure on both sides of the eardrum the same. Obviously the air could come in through the external acoustic meatus, but there's a little tube that goes back to the back of the nose, which is called the eustachian tube, that stays open, that allows air to fill here, so the air pressure is equal on both sides of the tympanic membrane. But what happens is there's small little air cells, little holes, and they lead to this area called the mastoid process. Okay, and inside that are also what are called mastoid air cells, which are basically very much like the alveolar bone that we saw in the mandible and as well as the maxilla. It's a lot of open cells, and so sometimes kids, when they have an ear infection, okay, and they get pus in that area of the middle ear, it actually ends up getting into that area of the mastoid, and then it's called a mastoiditis. So that little bump back behind there is called the mastoid. Also, if you take your head and you go this way, and you can feel that muscle from here, okay? Okay, I'm pushing against my chin this way, but on this side I could feel that muscle that comes down. That's called the sternocleidomastoid muscle, sternocleidomastoid, SCM, okay? And what happened is sterno means part of it's down here, it's attached to the sternum. Cleido is another word or another root for clavicle, and the other one is mastoid, sternocleidomastoid. So it starts up at that little bone behind the ear and goes down to the ear of the sternum. And it's involving in stabilizing the head and rotating the head a little bit, okay? So that's called the mastoid process. Just in front of the mastoid process, okay, and this is all in the temporal bone, okay, the external acoustic acoustic meatus and the mastoid process are all in the temporal bone, which is, this bone right here. There's a little bump that stands down there. It's called the styloid process. Okay, and that's also for muscular attachment. It'll be down there. It's almost like a spike. You see the little spike right there? That's the styloid process. Okay, and basically it sticks down, and it's for attachment of soft tissue and muscle. Okay, so that's called the styloid process. And we already talked about the mandible. So we always talked about the body of the mandible being this area is being the angle, and here's called the ramus. So here's body, angle, ramus, okay? And then we talked about here's the joint, the temporomandibular joint, and so forth. And here's the coronoid process right there, which is for that temporalis muscle to attach to, like we talked about before. So that's just looking a little bit at the lateral of the skull. A couple other things we could talk about with that temporal bone. Temporal squama is basically the bone of the temporal bone. Okay, that outer shell, inner shell, and then the cancellous bone between. Here's my external acoustic meatus. Again, if we look here, external acoustic meatus, right there. Okay, there's an internal acoustic meatus because that's it goes through. Now this is looking at the inside. Okay, so this view right here and this view right here are looking inside the cranium. Everything that's purple here is still temporal bone. Here's the temporal bone here. That's all temporal bone. This is all temporal bone. So this is on the inside. We'll see a little bit more. There's a ridge on the inside, and we'll talk about this a little bit later when we talk about cranial fossas in the third video. There's a ridge coming right down there, which is really hard. Very, very, very dense bone. It's called the petrous portion. The petrous portion, and that's that area right there. You'll see it a little bit better when I show you the inside of the skull. It's called the petrous portion, and through that comes the internal acoustic meatus, which is right there. Okay, and that was going, to the inside. Okay, so we have our external auditory meatus, or acoustic meatus, internal auditory acoustic meatus, the mastoid portion, which is basically, again, the portion that sticks behind the ear, that portion right there, and you can see it right there. That's that right there. There's the styloid process right there on that. Mastoid air cells are, again, those cells in the mastoid. And I know my dad, when he was a kid, my dad was actually raised in an orphanage, and when he was a kid, had an ear infection, and who took care of the kids in the orphanage, and basically end up with a mastoiditis, and it's caused a bone infection behind his ear, which bothered him all the way through his entire life. Okay, he finally had it surgically cleaned out and stuff like that, but he totally lost all the hearing in that particular ear. Okay, so anyway, that's what we have with the temporal bone. Otherwise, it's not that exciting. I definitely think I would remember with the temporal bone, the most important things about the temporal bone you should remember are the, at least from what we see externally, okay, are the external auditory or acoustic meatus, the mastoid portion of the temporal bone, and mastoid, the mastoid process. I think those are the things that are most important that you see on the temporal bone. Okay, this is a little bit more of the temporal bone. Okay, and again, we talked about this before. We talked about the fact that the zygomatic arch, which we see here, which we see right there, part of it's from the zygoma, which is here, but part of it's from the temporal bone. So that's actually the zygomatic process of the temporal bone. Zygomatic process of the temporal bone. Okay. And that's this purple area right there, that purple bar that we see right there, the zygomatic process of the temporal bone. You can't see it really well on this. I'll show you better when we see the skull. But right down here, if you look really close, okay, there's like a little dot right in the middle of my circle, okay, and that thing's called the stylomastoid foramen. Now this is a really important hole, small but important, okay. Through that stylomastoid foramen comes a nerve called the facial nerve, okay. Have you ever heard of Bell's palsy? People who have Bell's palsy, what happens is the facial nerve is cranial nerve 7, and what it does, it supplies all the muscles of facial expression. Okay, it also has some taste. It has a little bit to do with taste and a couple other things. But basically, the biggest portion is it supplies the muscles of facial expression. Well, that facial nerve comes from the cranium, or come from the brain through the cranium, through the stylomastoid foramen, and to the outside. Okay, and as a result, sometimes that nerve swells as it goes through the bone, through that stylomastoid foramen, and when it does, it causes a paralysis of half the face. You'll see people with a Bell's palsy and the side of the mouth will droop. They can't close their eyes. Okay, the eye won't totally close and stuff like that. And again, there's really not much of a treatment for it. It just goes away on its own, but sometimes has residual effects which lasts for years. I have a friend who had a Bell's palsy, and this is now I bet you 15 years later, and he still has a little bit of a droop that you could see. You could see his one eye is a little droopy, and the corner of his mouth is a little droopy. I remember just after he had it, there's a muscle on the inside of the cheek called the buccinator, and the buccinator keeps the cheek tight against the teeth, okay, so that we don't get a lot of food and stuff like that trapped inside between the gums and the cheek. And with the Bell's palsy, that buccinator doesn't work, okay? And as a result, because of that, he would all be sitting there. We went to dinner with them just after he had that. His mouth was down, his eye was all droopy and stuff, and he's constantly trying to get or yanking around with his tongue and trying to get that food out from there because he couldn't keep the buccinator tight against his teeth. But that's called the stylomastoid frame, and I'll show you another thing that's a little bit better about that. Two other things that we should talk about, okay, when we talk about the temporal bone on the outside, and sort of like on the bottom side, is what's called the jugular foramen. Now you can't see it here very well. Jugular foramen, if I was to show you where it's at, the jugular foramen would be right about here, tucked between those two bones. And where I see it is that area right there. That's the jugular foramen. You can see where it says jugular foramen right there. That's the jugular foramen. And I'm going to give you one guess as to something that goes to the jugular foramen. Yeah, the internal jugular vein. Okay. Actually, what happens is the venous blood in the brain doesn't really come in like veins. Okay, it sits in what are called venous sinuses, which are actually folds in these membranes that cover the brain, and that's how we get most of the blood back out of the skull, the venous blood to go back to the heart. And if you look down here, okay, I'm going to show you here. We'll talk about this in our next video. But if you look down here, there's sort of like, let's see if I can draw it here. So there's like this S, there's like an S-shaped sled type curve, toboggan curve that comes like that, comes like this, and ends up in that area of the jugular foramen. Okay, that's a venous sinus, and so what happens is this venous sinus goes all the way down to that jugular foramen, and then the internal jugular vein comes from the bottom of the skull out. Okay, it continues as the jugular vein once it leaves the skull, but that's the jugular foramen. Besides the jugular vein that comes out of there are a couple cranial nerves, 9, 10, and 11 come out of there as well. So some cranial nerves come out of that area called the jugular foramen, which is right there and right there. Okay, so that's the jugular foramen. We also have another thing that we should talk about here. It's called the carotid foramen. Okay, the carotid foramen. Well, the carotid foramen is basically a little bit more anterior. I'm going to find it up in here. Okay, up in here. Okay, it's sometimes called the foramen lacerum. Foramen lacerum is the carotid foramen as well. And guess what goes through the carotid foramen? Obviously, the internal carotid artery. We'll talk a lot more about the internal carotid artery when we get to the vascular portion. Okay, so those are just a few things that you should know about looking at the skull from the inferior portion. I definitely know the zygomatic process. Okay, the zygomatic process right here. I would definitely know the. One thing I didn't show you here that I should have shown you. Okay. Let me get rid of this right here, and you can see it right. Okay, let me draw it. Let me just draw it so you can see right here and right here. Okay, that's the mandibular fossa, and we talked about in our last video how there's a condyle at the top end of the mandible, just above the ramus. Okay, that fits in that temporal mandibular joint. This is where it sits in. It sits in that little socket right there, and that's called the mandibular or glenoid fossa. Another glenoid. Why another glenoid? I don't know. But that's the mandibular fossa. Probably say mandibular as compared to glenoid. I think glenoid, I think more of the shoulder and not so much of the mandible. But that's called the mandibular fossa. It sits right there. And that's where those condyles, that rounded end in the top portion of the mandible, sits in that little socket right there. Let me get rid of that and you can see that. Okay, let me show you what look on a bone. Okay, this is looking on the inside. If we look on the inside of the skull, so I've taken off the top, everything in green here will be the temporal bone. Okay, right here would be the area of the jugular foramen, and then right here would be the area of the carotid canal, or the carotid foramen, or foramen lacerum, whichever one you want to do, whichever one you want to say. This area right here was the one I talked about, which is called the petrous portion. It's a ridge. It's a very firm ridge. You can actually see it sitting up here. It's like a peak. It comes all the way across, and that's called the petrous portion. Petrous is a word. Petrous means hard, like Peter. Peter means hard. Petrous, or rock. Okay, and basically that's the petrous portion, very hard. And this over here in orange is the temporal bone. Here's the zygomatic process of the temporal bone. Here's the external acoustic meatus, or external auditory meatus. Both words are okay. Here's the mastoid process. Here's the styloid process that's down in there. Okay, so that's what we see there. Let's look at it from the outside. And this is, again, just looking at a more of a regular skull. And here's my temporal bone. It's coming down here. Here's the mastoid process right there, the external acoustic meatus. Here's the styloid process sitting down in there. Here's the zygomatic process of the temporal bone. Here's the mandibular fossa right there, where the condyle of the mandible right there sits inside that little fossa. So we can see those things over here. Again, here's the temporal bone, zygomatic process of the temporal bone. Here's the external acoustic meatus, external auditory, whatever you want to say. Here's the mandibular fossa that would be sitting right there. There's the styloid process. There's the mastoid process. Those are things I think you should know. Okay. And when we look at it underneath the, or with a radiograph, I mean, you can see the mastoid air cells right here. See how it's open? See how there's darker areas in there? Look at that. Okay, follow that down there. If you follow that down there, you see the mastoid air cells. See how it's looks like there's air pockets in there, and those air pockets again sometimes get pus from the middle ear after the ear infection, and they get trapped inside there. Okay, here's the condyle of the mandible sitting right there. We could see that. Let's see. That's probably what you see. Oh, here's that sella turcica like we talked about before. Okay, the area where the pituitary gland sits in. Okay. You could read the rest of, that's temporal bone, obviously. That shows the temporal bone, where the temporal bone would be. Parietal bone. If I look at the parietal bone, that's this one right here. Okay? And, if you look at all these lines, okay, I got lines, tons of lines going here. I got tons of lines going here. I got a lot of lines going through, but they don't go, they go to the temporal. I have one thing going to the parietal bone, and that's the parietal bone. You know why? Because there's really not much interest in the parietal bone. Strong bone, covers both sides of the skull, but besides that, not much there. Here's the parietal bone right here, okay? And that's the parietal bone, and if you know that, you're in good shape. Guess what? There's probably not going to be a question on a test about the parietal bone, except the only question I would ask is, which of the following bones are paired, and obviously the parietal bone is paired where the frontal bone isn't, the occipital bone isn't, the sphenoid isn't, but the parietal bone would be. Okay, that'd be a good question, but it's pretty easy. Actually, that's really easy. Okay, way too easy. You guys are smarter than that, so probably more to answer that one. And this is just looking at the parietal bone right there. See how exciting it is? It's really sort of boring, We see white bone, and that's all we see. So that's what the parietal bone has for you, and that's hopefully that didn't get you all excited for the evening. And here's the parietal bone. There's going to be a suture come right down the middle, okay? And here, and the suture will divide here, and will divide here. Parietal bone here, parietal bone there. That's it, okay? That's parietal bone. Actually, the suture is a little bit higher, but that's okay. Anyway, let's look at this here. Here's the posterior cranium, okay? Here's the sagittal suture. Comes right down the middle. So there's a parietal bone here, parietal bone here. What we see is the major thing that we see in the posterior aspect of the cranium. We'll look at the back. Is this bone right here. And that bone is the occipital bone. Occipital bone. And the back of the head is called the occiput. So if you look at when they say they have an injury to the occipital region or the occiput is this area in here, okay? And basically the posterior cranium or the occiput is where the parietal bones, the mastoid portion of the temporal bone, which is down That mastoid process, temporal bone would be down here and down here, and the occipital bone come together. Okay, they all come together. Now, one thing I want to talk about here in regards to the let me get rid of those lines. Okay. One thing I want you to look at right here. Now take your hand and feel right at the back of your head, right in the occiput. You're gonna feel a little bump right back there, a little bump. Okay, and that little bump is this area right here. And that is called the external occipital protuberance. It's a little bump that's right there. Now, if you're really lucky, it's right in the middle, okay? And sort of like, I can't turn over and so you can see, but it's right in the middle. You can't miss it. I mean, if you use your fingers back there, if you use your fingers from there, you go, you can find it, okay? If you go laterally from that, you're going to feel a little ridge. You're going to feel a little ridge, okay? And that's this area right there. And that little area that would come down this way and this way is called the superior nuchal line, the superior nuchal line, okay? So from the middle of the external occipital protuberance, which is right here, okay, we have the superior nuchal line that goes both ways. Now below that, there's another line down below that. You really can't feel it. That's the inferior nuchal line. The inferior nuchal line would be down there. Now, the reason why you can't feel the inferior nuchal line is because what happens is the muscles for the back of the neck attached from there, so you really can't feel it. This area, the inferior nuchal line, is all covered over by muscle, so you really can't see it. So the top limit of most of these neck muscles, because nuchal means what? Nuchal is a word that means neck. We learned that at the very beginning, something that I'm expecting you to be able to remember. So what happens, the upper limit of these neck muscles is at that superior nuchal line, so they really cover over the inferior nuchal line, okay? So anyway, that's that. That's the inferior nuchal line and the superior nuchal line. Let's get rid of that stuff. Okay. What we also have back here is called the lambda. Okay. The lambda. And the lambda is basically a junction of the sagittal and lambdoid sutures. Okay. And what we're talking about is the sagittal suture comes right down the middle. Okay. Sagittal suture comes right down the middle. And then what we find is the lambdoid sutures comes down this way and this way. It creates something that looks like this, which is like a Greek letter lambda. Okay, so that's called the lambda. Okay, it's basically a junction of the sagittal and lambdoid sutures that come together. Sometimes there'll be a little depression, and when we look at, we'll talk at the very end about something called fontanelles. Fontanelles, okay? And fontanelles are those soft spots that babies have. We'll talk about that a little bit later. I got a couple slides on fontanelles at the very end, okay? So you should be able to look at that posterior cranium. Again, not a whole lot really exciting in there. I definitely think I would know the external occipital protuberance, the superior nuchal line, and I think I'd know the lambda, the junction of the sagittal suture, as well as the lambdoid suture. So the sagittal sutures come this way. These are, we talked a little bit before about sutural bones. Let me get rid of this here for a second, okay? Remember we talked in the general osteology. We talked about different types of bones, and one of the type of bone that we mentioned was sutural bones. And sometimes what you'll see is embedded within these sutures, you'll see a little island of bone, and those are just called sutural bones. Okay, they don't have to be there; they could be there. If they're there, that's not a problem. It's just another center of ossification that united, and in adults they're all together anyway. It's all nice and hard. Again, this is looking at that posterior cranium. Again, what we saw before. Here's that lambda. Here's the sagittal. There's the lambdoid sutures. Here's the external occipital protuberance. Superior nuchal line, inferior nuchal line, inferior nuchal line. Here's the mastoid, and that's about what we see there. Same thing here. External occipital protuberance, superior nuchal line, inferior nuchal line, lambda. Stuff we talked about before, so everybody should know all that's not a big deal. Okay, again, this is the, we don't have to go over this again. This is what we've talked about already. One thing I did want to mention on this slide that's a little bit different. Okay, we've seen this, so that's you should know that by now. But when I start to look, and this is looking at the bottom of the occipital bone, okay, and we'll talk more about this view here when we talk about the cranial base. But in the occipital bone, there's that large hole that's at the base of it, and that hole is called the foramen magnum. It's called the foramen magnum, okay? And that foramen magnum is basically, foramen means hole, magnum means big, and that's the hole where the spinal cord comes out. So the brain's inside, the spinal cord comes out that really big hole down there. That's called the foramen magnum, okay? So that's what we should talk about at that point. Couple other things, and we'll talk more about this again, I think, when we get more into the talking about the cranial base. There's also an internal occipital protuberance, okay, which is basically right opposite the external, which is on the inside of the cranium right there. And then if we look right here, on both sides of the foramen magnum. Again, repetition is always important. These are called occipital condyles. Remember how we talked that C1, which we know is called everybody should say, atlas, has those little rockers on the top, the little like depressions on the top. Well, these little occipital condyles are the bottoms of that rocking chair that sit inside there. So as a result, they're on both sides of the foramen magnum, okay, and that allows that head to move so that the skull moves this way, because that's a joint, that's a joint. So this whole thing is a joint, okay, and basically that allows the skull to move in a sagittal plane, okay. So that's called the occipital condyles. I'll show you those in the next video, and again, repetition is always a really good thing, okay. The more you see it, the more you either like it or the more you hate it. Hopefully you like it more by the more you see it, but if you don't, well, you can lead a horse to water, but you can't always make them drink. Anyway, let's go on, okay? This is just another view showing the same thing. Here's my sagittal suture, here's the lambdoid suture, here's the lambda right there, okay? Here's the mastoid process down in there. Here's the occipital bone, okay? It's the squama, okay, which is basically we got a outer cortical bone, inner cortical bone, and the cancellous bone in between. That's all that means. Here's the external occipital protuberance. Here's the superior nuchal line, inferior nuchal line, okay. Here basically, here's the temporal bone. This is a parietal bone, occipital bone. Okay, those things are pretty obvious now. You should probably have that all down pat. This is just looking at skull representation. It's not a really one, nobody has these things printed on their skull like that, like cranium and, occipital. But we could see sort of by this representation, here would be my sagittal suture, here would be the lambdoid suture, and this area right here would be the lambda. It doesn't show an occipital, external occipital protuberance on this one, but here you go. Here's the external occipital protuberance. The superior nuchal line would be right here, right here. Here's the sagittal suture. Here's the lambda. Here's the lambda. Occipital bone, parietal bone, parietal bone. Okay, pretty much what you see. Here's the mastoid process right there. Mastoid process right there. So these are things that you should see. Here's the inferior nuchal line, inferior nuchal line. Again, external occipital protuberance. Okay, piece of cake. Everybody got that. This is pretty simple. This one, I think, talking about the rest of the cranial bones is relatively simple. This is just some x-rays that show those. There's the occipital bone, pretty boring otherwise. Again, here's the mastoid air cells in there. Here's the external acoustic meatus sitting right in there. Other than that, there's not a whole lot more to see. You can see a little bit of a remnant of the lambdoidal suture. Okay, you can't see the sagittal suture because it's up on the top, okay? But you see where the lambdoidal suture comes there. You can actually, let me get rid of that. You can see a little, if you look really close, you're able to see it, but besides that, that's okay. This is just looking at the back. You can see the foramen magnum. Why am I seeing the foramen magnum? It's not in the back of the skull. That's that superimposition. Okay, they're looking at the skull in such a position that they're looking down, and you can see the area where the foramen magnum would be right there. Okay, but that's why that white area is. Other than that, you can't see a whole lot. Okay, here's the mastoid air cells. You see mastoid air cells that you'll see over here. Mastoid air cells over there. Parietal bone. So whatever. Okay, but that's the occipital bone. Actually, the head's pointing downwards. Okay, so actually, here's the lambdoid suture. You can see a little bit of a sagittal suture right up there if you look really close. Okay, so it depends on how close you want to look and how good your eyesight is. The superior cranium. Okay, now the superior cranium isn't a perfect oval. It's sort of like an oval, but it's not a perfect oval. It's a little bit wider posterior laterally, normally, okay, at the parietal eminences, okay? So instead of being a perfect oval, it's more like that, where it's wider here, a little bit narrower in the front, Okay, it's the roof of the neurocranium. You know, if you go right through there, you're right inside the brain. Okay, and basically it's four bones that form the superior cranium. Obviously, the frontal bone, which would be up in here. Okay, the parietal bones on both sides, and the occipital bone in the back. Okay, so parietal, frontal, occipital. Okay, and that's what we see there. Basically, four simple bones. Okay, uh, sutures, again, those sutures are those areas, those joints where the bones come together or when they're locked together. Okay, the coronal suture separates the frontal from the parietal bones. We showed that before. It goes from side to side this way. So the frontal bone would be in front, the parietal bone would be behind. Okay, that's the coronal suture. The sagittal suture separates the two parietal bones, comes right down the middle. Okay, so right side, right parietal bone from the left parietal bone. Perfect. The lambdoid suture separates the occipital bone from the parietal bone. Okay, piece of cake, easy. Okay. What we have is we also have the intersection of the sagittal and the coronal sutures. Okay, if I look at the sagittal suture and the coronal sutures, and that area is called the bregma. Okay, and that's the area you're going to see. I'll show you in a little bit, a couple minutes here with a couple last slides. That's the area where that soft spot is in the front, that area called the fontanelle. Okay, so that would be called the bregma, right where the sagittal and the coronal sutures come together. Again, the sagittal is going to divide the parietal bones, and the coronal suture divides the frontal bone from the two parietal bones behind it. Okay. We have one other word we should mention here anatomically. It's called the vertex, and the vertex is the most superior portion of the cranium, which is basically right here at the top. If you look right here at the very top, right here, right almost where, just a little bit above where the occipital bone starts, but at the top, that's called the vertex. Okay, when during a delivery, if it's a head first delivery, it's usually called a vertex delivery because the vertex, the biggest portion of the cranium, is coming first. Okay, and that's at the midpoint of it's gonna be the highest point. It's just above the area where the lambda would be, just a little bit more anterior to that and a little bit above it, and that would be where the vertex would be. Okay. This is also a weird thing too. Head shape is so different from person to person. If you take a baby whose head could be really molded, okay, lay them on one way, and all of a sudden they might be flat on one side. There were some cultures years ago, hundreds and hundreds of years ago, where they used to bind the head because they wanted a head that was a better shape, and they'd bind it so it would have a higher area in the vertex. Crazy stuff. Okay, if you ever see a baby just after it's born, if it's a vaginal delivery, everybody says, "Hey, look at that beautiful little baby," and what you're looking at says, "Look at that funny looking head," because it comes out like a point. Because everything is all squished together, and because the bones are not connected at that point. They're connected by connective tissue, but it's not bony. Okay, but you know what I mean if you've seen a baby that's just born after a vaginal delivery. But you know what I'm talking about. Okay, you always say, "Yeah, it's a beautiful kid. Why does he have such a funny looking head?" That head will mold after a period of time. It comes, but molding can be changed by the way that the head's kept, what positions it's in that can actually change the shape of the head. Okay. This is again looking at that bregma, and if I look at that bregma, here's the frontal bone. Okay, obviously, because you know why I know that? Because it says frontal. There's the frontal, there's the nose right there. And then here would be the sagittal suture, this would be the coronal suture. And so this area where the sagittal suture and the coronal suture come together, it's called the bregma. Again, this is going to be obviously posterior, and this is obviously going to be anterior. Okay, so that's the sagittal suture down the middle, meeting the coronal suture, and right there it's called the bregma. Okay, that's pretty obvious. Okay, it's easy to see that, not a problem. So you look at that. And again, this is what we're talking about here. This is actually a good view. I think it's easier to probably see on the left than it is on the right. Okay, if we look here, here's the coronal suture. So this is anterior, this is posterior. Okay, so we should be able to figure this out. What's A? Let's see if we could, let me just quiz you here. And don't look at the right side picture, just look at it. What is A? A is the frontal bone, obviously. What is B? Parietal bone, parietal bone. What is C? Occipital bone. Okay, what is D? Coronal suture. What's E? Sagittal suture. What's G? Lambda. What's F? Lambdoid suture. Okay, so we could see all that stuff. There's the lambdoid suture down in here. So basically, we get to actually look at that. It's a pretty good skull to be able to see all those suture joints and stuff like that. And that's what they are. Again, you'll see they look like a snaking river that's going up in there, and it allows these little pieces when they come together. They come together and they sort of lock in and makes the skull quite firm. And again, the skull is round, and the skull being round provides a lot of significant mechanical stability. You know, if you put a pipe in something, you don't put a square pipe in, you put a round pipe in, because a round pipe mechanically and physically is much stronger than something that's square. The walls will collapse if it's square, where in this it doesn't. Okay, so it does provide significant amount of strength. And you think about it as when you look at the thickness of the skull. If we were in the lab, I'd be able to show you and pull the top of a real skull off, and you could look at the inside of it, and basically it's not all that thick. Okay, you know, it's probably, you know, maybe a quarter of an inch, if that, thick in most places, you know, or in much of the skull. So it provides significant strength by being relatively thin by its rounded shape, which is important. Okay, and you can actually look over here. It has sagittal suture, parietal bone, coronal suture, frontal bone, bregma. Bregma would be this area right there, obviously. Okay. And this is just looking at what are called fontanelles, okay? And fontanelles, this is like a diagram of what we see. So this is called the anterior fontanelle right here, okay? And let me just, that's a bad drawing. Let's do it again. Let me do it again. The anterior fontanelle is a little bit triangular shaped. The posterior fontanelle is more diamond shaped. The posterior fontanelle is more triangular shaped. And there are actually fontanelles on the side as well. Okay, nobody looks at those. When a baby is born, okay, this is interesting. The anterior fontanelle, that soft spot, when the baby's come down the birth canal, you can't see the baby's face, so you don't know if the baby's nose up or nose down. Now, the way the baby usually comes down the birth canal is nose down. That's the most typical way. If the baby comes nose up, usually the labor takes a little bit longer. It's a little bit more difficult for the baby to come out. It's not like that's a rudder or anything like that, but it's just for some reason it just takes a little bit longer, sort of like on an average. Okay, so what they could do is they could actually determine the position of the baby, because what they could do is when they do a manual exam, they feel for the fontanelle. If they feel the large fontanelle, that's more of a diamond shaped fontanelle, and if it's down towards the tailbone, towards the coccyx, towards the sacrum, they know that the kid's coming nose down. Piece of cake, which is the right way to come. Okay, if it turns out that that diamond shape or the larger fontanelle is more towards the abdominal wall, the anterior abdominal wall, it's coming nose up, and it's called a posterior delivery, which means might be a little bit longer. Okay, but that's that. So these fontanelles are there. The fontanelles are not really, it's not like brain tissue in that hole. It's covered over with a lot of connective tissue. I mean, I wouldn't sit there with like a pencil and keep on jamming it. That would be a bad thing to do. I mean, that would be enough for a jail sentence, I would think. But what happens is the fontanelles will fill in, and they gradually close. The anterior fontanelle will start to close, and usually close by about a year, maybe 18 months at the outside is closed. The posterior fontanelle closes a lot earlier than that, usually about 9 months and stuff like that. They're closed. But if you have a newborn or something like that, and you watch them, you'll actually see when they breathe that fontanelle will go up and down, because there is a change in the intracranial pressure with respirations. So the fontanelle will go up and down. You see it not a whole lot, just a little bit. I mean, it's not like you don't see that thing like popping up and down, you know, and stuff like that. Hey, you put a quarter on there and it pops off. Or no, it doesn't happen like that. What happens is you'll actually see a little bit of movement out of it, because with breathing, the respirations do change intracranial pressure, and as a result, the pressure will cause those fontanelles to move just a little bit. So watch a baby, you know, I mean, wouldn't stop somebody and say, hey, can I watch your baby's head for a while, you know, or because then you'll probably also get arrested. So don't do that. But if you do have a friend with a newborn, if you look at the fontanelle, you know, you'll see it moving up and down a little bit. If a kid's dehydrated, what happens is that fontanelle is all sunken. If a kid has an infection, that fontanelle is bulging. Okay, so they could use those fontanelles diagnostically early on, but they're called fontanelles. They're called fontanelles. So the fontanelle is the word for all these soft spots that we have. Okay, and again, mostly looking at the anterior and posterior fontanelle. Anterior more diamond shaped, much larger, closes later. Posterior fontanelle smaller, more triangular shaped, and closes a lot earlier. Okay, those are just the fontanelles. And if we look at a fetal head, okay, you can see this large fontanelle. It's very, very large. Okay, it's pretty big. It doesn't feel that large when you feel it. This is a little bit younger. Okay, but that's the anterior fontanelle. Again, they'll close. This would be the posterior fontanelle. And basically this would be, if we look at it, this area right here would be the occipital bone, here would be the parietal bone, and stuff like that. Here would be the frontal bone coming together. Here's the parietal bone, here's the frontal bone right here, and the occipital bone's back here. Okay, so anyway, that's what we'd see with that. So those are interesting. This would be the parietal, this would be parietal, this is frontal, and the frontal is actually going to come together as one large bone because it's actually more united in the front where the parietal isn't. Okay, and that's what we see with fontanelles. So what did we talk about in this video? A lot of basic stuff. I mean, this wasn't really as interesting as some of the other ones. The next one we talk about is going to be the cranial base. Is really, really, really cool, or really difficult, depending upon how you look at it. But what we've talked about is basically the rest of the cranium. The cranium, the neurocranium, besides the facial bones, is comprised of the frontal bone in the front, okay, and the two parietal bones, one on each side. The frontal bone is divided from the parietal bone by the coronal suture, okay. And what happens, the parietal bone is separated from right side parietal bone to left parietal bone by the sagittal suture, okay. We talked about the temporal bone. The temporal bone is a little bit exciting because it does have that temporal fossa where that temporalis muscle fits in there. We talked about the mastoid process is there. The area of the styloid process is there. The stylomastoid fragment. I forgot to show you on the one skull. Actually, is a nice representation. If you go back to one of, and you'll see it more when we get to the cranial base. Remind me. Well, you can't remind me, but I'll try to remind myself when I look at the cranial base just throughout the stylomastoid fragment. It's right between the styloid process and the mastoid process. Okay, it's right there, little hole for the facial nerve. And then we talked about that. We talked about the external acoustic meatus. We talked about the occipital bone being divided by the parietal bone by the lambdoid suture, and that the sagittal suture and the lambdoid suture come together, creating a lambda. We talked about the external occipital protuberance, the superior nuchal line, the inferior nuchal line, blah, 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 on and on and on, and fontanelles, okay? So this is one that shouldn't take you a whole lot of time to go through if you have to review it, but hopefully, again, as always, if you have any questions, make sure you let me know, email me, don't leave any question unasked, and other than that, be safe and be healthy, and we'll talk to you with our next video shortly.